Politicians argue whether this constitutes a crisis. At least 7 hospitals in England currently have declared major incident status as they struggle with patient numbers. They are Addenbrooke's, Royal Stoke University, Ashford and St Peter's, Peterborough City, Gloucestershire Royal, Cheltenham General and Walsall Manor. Patients like 81-year-old Florence Cunningham certainly experienced a crisis, waiting 11 hours for an ambulance after she collapsed at home, then being left on a trolley outside A&E at Portsmouth.
It was soul-destroying and heartbreaking to see her crying and just in pain, and I just couldn't help her.
The hospital has apologised, blaming unprecedented demand. For a measure of the pressure on the NHS front line, just spend a few minutes in the emergency control centre of the South East Coast Ambulance in Surrey.
Is the patient breathing?
Is she making any gurgling or wheezing noises?
Okay, are you right by him?
They receive up to 3,000 calls a day like this. This part of the NHS is working flat out and at full capacity. It's hard to imagine how they could do more or be more efficient. These people taking 999 calls are all experts in their own fields, but there is growing criticism that the same does not always apply to those manning the 111 service. Set up to replace NHS Direct in 2013, 111 staff are non-healthcare professionals and have been accused of sending too many patients to A&E. Unfairly, some say.
Only about 7% of calls come into 111, and that's over 1 million a month. Only 7% are referred to A&E.
The volume of emergency calls is clearly the biggest factor. Worryingly, in this part of the country, the new year has started with a 25% increase. Paul Davis, ITV News, Surrey.
Yes, well, whether or not there is a real crisis in the NHS, this is developing into something of a political crisis for David Cameron. In the Commons, he accused Ed Miliband, the Labour leader, of disgusting behaviour in trying to politicise the issue, but it was an attack that rather backfired.
I'll tell him what's disgusting. It's a Prime Minister who said people could put their trust in him on the NHS, and he has betrayed that trust. Mr. Speaker, he's in denial about the crisis in the NHS. This is a crisis on his watch as a result of his decisions. That's why people know if they want to get rid of the crisis in the NHS, they have to get rid of this Prime Minister.
If ever you wanted proof that they want to use this issue as a political football, you've just seen it.
Well, David Cameron wheeled out all sorts of facts and figures today about how many doctors and nurses had been recruited since he came to power, but he had less to say on the specific accusations from Ed Miliband that his policies had contributed to cuts in social care and the closure of walk-in centres. I think he is going to have to come up with some answers to those questions from Labour if he's to limit the damage over this issue. OK, Libby.